So now I will be discussing about the second structure. The second structure, which is test result structure. Test result structure. Okay? So simply, if a patient came to the hospital, or if a patient came to the GP clinic, or if a patient went to the A&E, or if a patient went to the GOM clinic, genitourinary clinic, and blood result was done, or blood investigations were done, or a CT scan was done, or biopsy was taken, and they showed such and such, talk to the patient to address his concern. So, what is the difference in this station? This station, which we call it test results, the only thing is that the patient is already been, the patient had swab taken, for example, if she's coming with, if she came with the discharge from the front passage and swab was taken, showed chlamydia, for example, or if she came with headache, CT scan was done, showed something, for example. So the difference here that there is diagnosis there. There is a diagnosis there. Test results were done or investigations were done and show things. Talk to the patient. So the thing here that you don't need differential. You don't need differential. You don't need differential because you have test results and showed something. So it's more of diagnosed station. That's the second type, which is test result. But what is my approach? My approach, again, open the cubicle, always introduce yourself. I'm Dr. Fath PLAB, one of the general doctors here. Can you please confirm your full name and date of birth? Then I will start. In this kind of stations, the station will be divided into three parts. The station will be divided into three parts. Okay? Okay. What are the three parts? What are the three parts? Part one in the station is a modified simple history taking. Okay? Part two is explaining the results. Part three is management. So part one will be, this is the first part. I will call it as modified, simple history taking. Really? Modified simple history taking. What do you mean by that? I told you that the case is diagnosed. Blood results will be there in the cubicle. CT scan result will be there in the cubicle. Biopsy result will be there in the cubicle. It is diagnosed. That's why I call it modified history taking. And I will tell you now what I mean by modified. The second part will be explaining the result. Explaining the result that you have. Very important. If you don't explain the result, it is the core of the station. This is the second part. The third part is management. So again, three parts: modified, simple, history taking, explaining the result, management. However, you need to be flexible. Why? Explaining the result could come before the modified history. So you could start with explaining the result and then modified simple history, or modified simple history and explain the result. So it's okay to bring the result first. But how do I know? I will tell you now. So how should I start? Well, Alicia, I can see from my note that you are coming today to know about the swab result. Yes, doctor. Now you have a swab result in the cubicle. So now I will tell you which is which one should you start with first. So, would you like me to explain to you the result first, or should we have a chat first about what happened? So now you are giving her the option. Alish, would you like me to tell you the result first, or should we have a chat, which means history? Doctor, anything. Then start with the history and explain, and then management. No, doctor, explain the result for me. Then you will explain the result first, and then you will take history second. So again, what is the approach? Hi, I'm Dr. Fath PLAB, one of the general doctors here. Can you please confirm your full name and date of birth? She will confirm the full name and date of birth. Well, I can see from my notes here that you are coming to see me in order to know about your swab result. Yes, doctor. Would you like me to explain the result first, Or is it okay to have a chat in order to explain the result in a better way? Well, doctor, do whichever you want. Then you will start with the chat, with the history. Well, doctor, no, explain the result. Then you will explain the result, and after explain the result, you will say to him, is it okay if you have a chat then, so we know more about what's happening? So you can start with explaining first, modified history first. It's up to you. No, it's not up to you. It's up to the patient choice. Okay? Then, what is the history that I will take? The history that I will take, it will be relevant history. What do you mean, doctor? I will only ask about the symptoms that brought her and the risk factor and the complication. So I will say to her, can you please? So in the history here, I will write number 3. What do you mean by number 3? I will ask 3 things only. So can you please tell me what brought you for this result? What brought you to have these tests from the first place? What brought you? This is the first question. What brought you to have these tests, these investigations done from the first place? She will give you some symptoms. She will give you some symptoms. She will give you some symptoms. Then you can explore them. And that's it. No differential. What is the second question? Risk factors. Risk factors. Risk factors about what, ya brother? Risk factors about the condition. For example, she had a swab done, showed chlamydia. What are the risk factors? What are the causes of chlamydia or gonorrhea? Sexual history. Then you can take sexual history. Okay? So risk factors. Then complications. Then ask about complications. What are the complications of sexually transmitted infection or gonorrhea? PID. It can complicate into PID. Then you can ask about questions for PID. So again, Dr. Mo, you have mentioned to us that you need to take modified simple history. What is the meaning of modified simple history? Modified simple history means that I only need to take the relevant history. What do you mean, Dr. Mo? Only 3 questions. Only 3 questions in the history. Number 1, what brought you for these tests to be done from the first place? Or what made you come for these tests from the first place? The patient will give you some symptoms. I came because I had chest pain. I came because I had discharge, whatever. Explore the symptoms. Explore the symptoms. Explore the symptoms. Okay, what is the second question? What is the second question? Risk factors. For what, Dr. Mo? Risk factor for the condition, because I told you from the start that in this kind of cases, it is known diagnosis. When she had a swab, it shows gonorrhea. It will tell you she had a swab that showed gonorrhea. So when you ask about risk factor, you are targeted, you are relevant to the causes, of all the risk factor of STI. Then complications of STI. Another example, if the patient is coming and she had blood results, for example, microcytic hypochromic anemia, MCV is low, MCHC is low. Again, you know it's anemia. So when you take history, relevant history, number 1, what brought you to have this blood test from the first place? That will give you symptoms. Tiredness, lightheadedness, chest pain, or heart racing. Explore them. Then ask about the risk factors. What are the causes for anemia? Number 1, diet. Number 2, malabsorption. Number 3, blood loss, bleeding. So ask these 3 risk factors. Then complication. What are the complications of anemia? So all the time you are asking about symptoms, risk factors, complication for the condition, the specific condition. Then, after you finish your small history, Dr. Mo, why do we ask about risk factors, Dr. Mo? Why do we need it? Because when you tell the patient the diagnosis, when you explain the result and tell the patient the diagnosis, he might say to you, Doctor, but why did I have it? Why did I have this anemia? You have already asked the risk factors. Then you can answer him why he had the anemia. So the reason why I take risk factors here, the causes here, is to be able to address his concern in management, which will be, why did I have this? The second part is explaining the result and the diagnosis, yeah? The second part is explaining the results and the diagnosis. So in this part, I will start talking about the result. Well, Mr. Andrew, we have here the blood tests, and then explain it. Or we have the thyroid function test and then explain it. Or we have biopsy and then explain it. Or we have CT scan and then explain it. Whichever results there, explain it in a very simple way. And that's why we are suspecting and explain the diagnosis. So, in the second part, we will be explaining the test result as well as the diagnosis. We will explain the result as well as the diagnosis. Not only the result, but also the diagnosis. And when you explain the result, please in details, explain the result. And the diagnosis, which you will have gonorrhea, chlamydia, iron deficiency anemia, whatever. Then the third part, which is management. So in management here, make sure that in management, we have the 3 golden tips or the 3 golden principles that I've already explained in the previous video about management. It is a management plan. So it is two-way conversation. You cannot force anything on the patient. So throughout management, you have to maintain this attitude. It is a management plan. It is a two-way conversation. Nothing is by force. I cannot say you have to. I cannot say you must. Nothing by force. So number 1 golden tip, I will maintain this attitude of nothing by force. It is a management plan. It is two-way conversation. I'm here not to force you on anything. I'm here not in order to have a plan, in order to discuss a management plan. First golden tip. The second golden tip, all the time I will tell the patient, why am I doing this? Why am I doing this? Why am I doing this? The third point is consent. Would that be all right? Is that something you can do? Is that something you can do? Would that be okay with you? So always maintain these 3 golden tips that I've discussed already in the previous video, but I will keep repeating them because you keep forgetting them. So in management, of these cases, test result cases, when I start talking about management, I have 2 parts here. As you see, modified simple history, 3 points. Explaining the result and diagnosis, 2 points. Explain what result you have and explain them. And in management, I have 2 big parts. Number 1 in management, the patient will ask you, why I had this, doctor, why? Why I had anemia? Give me a reason why. So in management, I need to address the patient concerns. So I need to address the patient concerns, which will be already, you got the answer from the history. So why did I have this, doctor? Why did I have anemia? Well, from the history that you told me, from the history that you've given me, then explain to him the risk factors. Then she can say, doctor, will I have PID? Again, from the history. So basically, in management will be 2 parts. Managing his concerns, managing his questions, managing his psychology, as well as the medical treatment. Again, in management of test result stations, I need to manage 2 big bulks, 2 big parts. Number one, managing the patient thoughts, managing the patient concern. And I cannot manage the patient concerns, I cannot manage the patient thoughts unless I have taken relevant, beautiful, small, relevant history. So then I can use this history to answer his concern. Number 2 is the medical treatment, which everybody will know. By the way, this is just a structure. I will be discussing every and each single scenario in the test result in the course. However, this is just a structure. So not only you managing the patient concerns, but also I will do the medical treatment, or I will also, for example, the patient who came to me 2 days ago and he had blood tests done, showed anemia. Very important to ask about the risk factors for anemia. Okay. Then when you go to management, not only you will give him iron tablets and talk to him about the side effect of iron and talk about the complication of iron, taking iron tablet, but also I will talk about the concerns. Doctor, why did I have this? And why did I have this in the concern? The answer simply will be risk factors. The risk factors that you will bring from there to here. So unless you take relevant history, unless you ask about the risk factors and the complication, then you're not gonna have an answer for your patients. So simply, this is test result, 3 parts. Part 1, modified simple history, relevant history, which will contain only 3 questions. What are the 3 questions? Number 1, why did you come for this test result in the first place? He will give you symptoms, explore. Number 2, the risk factor for which he's having this problem. Number 3, the complication. And how would you know the risk factor and the complication? From the test result. The second part is explaining the result in details, nicely, simply, plus giving him diagnosis and explaining the diagnosis. The third part is management, and in management you have 2 parts. You manage his concerns, you manage his thoughts, you manage his idea, you manage his brain, as well as managing his condition, and I've given you example. So, but before you start all of this, always the approach. Open the door, go to your patient, confirm your identity first. I'm Dr. Fatih PLAB, one of the general doctors here. Can you please confirm your full name and date of birth? Yes, he will confirm full name and date of birth, not age anymore. Full name and date of birth, then you will say to him, well, I can see from my note that are coming today for swab result, CT scan result, blood result. Would it be okay to have a chat first about the test result? Or would you like me to explain the result first? Or would it be alright to have a chat about what's happening? If the patient said result first, then go for the result, then go to the chat. If the patient said it's okay, doctor, go for the chat, then go for the result. Thank you very much. I will see you in the second video.